Welcome back. If you are just joining us, this is INX Prime Live. Remember, we are on your screens every single Monday to Friday between the hours of 6 p.m. and 8 p.m. Now, tonight we do have the privilege of speaking with Dr. Muzzamil Ismail, who is a public health medicine specialist at the Health Intelligence Directorate in the Western Cape Department of Health. Now, Dr. Ismail has an impressive background, having worked in the public, military, as well as the private sectors as a medical practitioner. Now, as well as a business analyst in the health department, his passion for leveraging data and technology to improve healthcare systems makes him a key speaker at the 42nd IMASA-FIMA Scientific Convention in 2024. We do know that this convention will be held on the 10th to the 11th of August at the Lord Charles Hotel in Cape Town. And the convention will feature his talk, which is on AI-enabled health. Now, an important and a topic of significant relevance in today's evolving healthcare landscape. Mr. and Dr. Ismail, thank you so much for joining us tonight on INX Prime Live.
Thank you so much for having me, Zarif. It's a pleasure to be here this evening.
No, it's a pleasure having you. Thank you again for joining us. Now, can you start by telling us a bit about your background and your journey as well in the field of public health medicine?
Sure thing. Shukran. Firstly, so much for having me once again. It's a real honor and privilege to be here. Just in terms of my background, so I'm a public health medicine specialist. I'm based at the Provincial Department of Health in the Western Cape. And what that really means is that I've trained as a medical doctor. I did my training in Cape Town at UCT. I then practiced and completed my 2 years internship in the Eastern Cape. I completed my community service, worked in private for a bit, and then I subsequently specialized for over 4.5 years in public health medicine. I was really fortunate, I must say, to have received that training during the COVID-19 pandemic. And that's fortunate because epidemics and pandemics are really the bread and butter. It's where public health shines and really steps up to the forefront. So that was really a unique experience and exposure. And then I completed my training last year, and I'm still going strong with the department. But really, in essence, it's been a phenomenal personal journey for me, and a true labor of love to be able to take on that responsibility of trying to contribute to and improve public health services for our communities.
No, and congratulations again on your years of experience and accolades, as well as some of the achievements that you have. I just want to touch on your role currently. Now, as a public health medicine specialist at the Health Intelligence Directorate, what are some of your primary responsibilities and also some of your focus areas that you focus on?
So, Sarif, that's actually a great question. And I think many people, including healthcare workers, struggle to envision what it is that we do on a day-to-day basis. And I think our role can span quite wide in terms of supporting the health system at every level, from anywhere from a facility management to a provincial management, even a national management perspective, both in terms of having direct oversight of healthcare services on the ground, to even going as far as strategically planning and optimizing any new healthcare services in the province. Where I find myself personally, I'm employed in a strategic unit, and the unit is the Provincial Health Data Center in Health Intelligence, as you mentioned. And we're fortunate to have quite a large team, and our primary focus, our primary core, is to integrate different public health data sources. And that's everything from lab data, medicine data, hospital admission data. You can imagine just the volume and complexity when it comes to healthcare and information in healthcare. And what we try to do is we try to combine all of those different disparate sources in order to get a complete picture in terms of what is going on in our context. And in that way, in that consolidated way, better understand what is happening with an individual person. And so that's like the how of what we do. But the reason why we do it is really to guide healthcare, if it's management in terms of healthcare policies. We use it to support decision making. We use it to guide prioritization, monitoring and evaluation. and just, in essence, how can we improve healthcare services with the best information that we have at hand? And then, very importantly, also, we use that same information to enable and support our clinicians in our clinics, in our hospitals, in terms of how best to manage their individual patient, the patient sitting right in front of them. And we do that by enabling them with the right tools and with the right information at the right time.
No,
So that, in a nutshell, is really just the core. Yeah. Thanks.
no, that's brilliant. And again, the work that you do is very, very important, and it's also very interesting. And again, thank you so much for the work that you do, because at the end of the day, it's to the public benefit, right? But I just want to touch on this upcoming talk that is coming up. I know that it is the IMASA-FIMA Scientific Convention that is taking place between the 10th and the 11th of August. I know your talk is actually titled about everything and anything to do with artificial intelligence, right? And it has to do with AI, an important chat when it comes to that in the health sector. Can you give us a bit of a sneak peek or preview of what this talk will actually cover and why this topic is so crucial for today's healthcare landscape in that sense?
Sure, not a problem at all. And let me start by saying I'm extremely excited by giving this talk, and I'm extremely grateful to IMA for providing me the opportunity to present on it. So in essence, I think data and technology is really at the forefront of pushing the boundaries when it comes to healthcare. But it's sometimes so much, and there's so much jargon and complexity that it really becomes quite difficult to truly grasp and understand and even keep up with how it can help or change what we do as healthcare workers or healthcare providers on a day-to-day basis. So in a nutshell, what I'm hoping to achieve next week is to give a basic foundation and introduction, as it were, to what's available out there, what's available in terms of healthcare and AI, and how we can, as practitioners in South Africa, safely and ethically introduce it into our day-to-day practice.
No, that's very, very exciting, and I'm sure a lot of people are going to be looking forward to that talk without a doubt. I'm sure a lot of people also on social media are following you to be able to find out more about some of the work that you do. But away from that, just going and zooming more into artificial intelligence, especially in South Africa, I mean, how do you see AI transforming healthcare in our country, particularly in terms of improving, efficiency, but also then the quality of care as well?
Well, that's a big question, Zuri. And we could probably have an hour discussion just on that. But maybe I can invite you to join the talk next week as well. No, but without going into granular detail, maybe I can just provide a high level overview with some examples of what I have in mind in terms of planning and what we're going to speak about. I think the easiest way to look at it, and the starting point, is to think of it in a basic interaction between a clinician and a patient, and how AI and data plays a role in that interaction. And it's really about tools and enabling tools. So, for example, there are several diagnostic tools that are now entering the sphere of, for example, radiology imaging. Where we already are not printing out our X-rays on film anymore. We have it on our computers, and it's accessible in that way. But essentially, we can layer that now with rapid screening and interpretation of those imaging tools to pick up things like cancer, like TB, and it can do that with quite high precision as well. So what that allows us is earlier and effective diagnostics when it comes to certain investigations. I think that's the first thing. The second thing is that as we get a bigger and wider picture from a data perspective on our patients, we can personalize the type of care that we provide. We can prevent the incorrect medication, for example, being administered to a patient that either has an allergy to it, has something in the genetics that is opposed to actually uptaking it, that doesn't agree with the kidney function, for example. And there's a whole host of personalization that we can build in when it comes to how we practice medicine. And then maybe something to mention that I'm personally quite passionate about is the potential in the sphere of telemedicine and remote care. So we have an opportunity, as it were, to really embed AI and data-driven telemedicine to provide access to healthcare, not just for people, that are close to a facility, or close to a clinic, close to a hospital, but even in far-strung, underserved, populations, and target specific groups of people that will benefit from early data-driven interventions. It's a whole sphere of us, almost reaching out to patients as opposed to waiting for the patient to complicate and then present to us when it's too late for us to actually do something about them. And we tried and we piloted this during COVID-19 with high-risk COVID diabetics. And it really works well when we are able to leverage what we have and target people at the earliest when the interventions, when the medications that we have at hand will benefit them the most. And then that's really from a clinician-patient perspective, but I think I'll be amiss if I don't mention that even within public health, at a higher level, AI and data is enormously valuable when it comes to allocation of resources and surveillance for any rare or any conditions in terms of if it's improving, is it not improving, and how can we actually go about improving it and ensuring that certain conditions, particularly infectious diseases, keep coming down. That's really, I think, the value from an efficiency and quality perspective.
I think you've explained that so well. And I think what also adds a lot of value in terms of how you're explaining it is the fact that you understand it in a holistic standpoint. And it's not just as a medical practitioner, but as someone who goes beyond that, someone who understands the ecosystem. And I think, just it probably plays a role in terms of your background as a business analyst in the systems development, as well as information management directorate. Just touching on those kind of things, how has that actually, influenced perhaps the way you look at the perspective of integration of AI and data in the public health space as well?
Yeah, I think that's an excellent point too. So I think the starting point has never been, throw technology at the problem, right? It's really to understand the system first. And I think that is my first exposure in the health department, is as an analyst trying to understand the value, the systems and the processes that run the system, and also how health information systems play a role in that bigger system. And health systems are really complex spaces. I mean, if you just think of the space that I work in, the Western Cape, 3/4 of the population rely on the public sector for their health, and that's about 5 million people. It's spans across more than 50 hospitals, more than 200 clinics, and trying to understand that complex beast is difficult, right? But it's also, it gives you the realization that through the use of standardized tools, through the use of technology, we can optimize the running and the functioning of these hospitals and clinics. And I think personally for me, once you see that, you realize that opportunity that exists to improve it. And I think that opportunity to contribute to that improvement is such a blessing, and it definitely wakes me up in the morning.
Yeah, without a doubt. I mean, I'm getting a lot of questions and comments coming in from social media as well. People are saying that they're extremely excited for your talk and they can't wait to actually hear from you in particular. But away from that, away from your own talk, right, what other aspects of the 42nd convention, or the IMASA convention that is taking place, are you actually looking forward to? And also, what do you hope attendees will actually take away from the event?
So I saw the agenda, and I think I'm equally as excited to see just how wide and diverse the full spectrum of topics are, and how this particular conference is bringing together both Muslim and non-Muslim healthcare workers from across South Africa. And for me, just that bringing together, it's places like this where networking and opportunities arise, where we can support each other. Where we can partner with each other and we can learn from each other in these spaces. And that for me, I think is very exciting. And I'm sincerely hoping that my fellow attendees also share that similar sentiment.
Yeah, no, everyone's very, very excited for it. Guys, don't forget, it is actually happening on the 10th and the 11th of August, and it's happening in Cape Town, so do make sure that you do attend if you are within the space. But away from that, I'm just going back to some of the questions and comments that are coming in. I mean, we have a question, more of a comment slash question from Imran. Now, Imran is actually saying that, he's just been through his process in terms of the medical space, and he wants to actually be seen as like the most popular, medical professional in South Africa. I mean, that's something unique. You never usually hear that. But, what advice would you give to someone like an Imran or any healthcare professional, for example, who's looking to integrate AI and data-driven, information in that sense to be able to uplift themselves, but also to empower their practice to become the best?
Yeah, that's a great question. So my advice would be, firstly, to start small. I think start with small, manageable projects that can really showcase value. And there's different ways of showing value, right? Whether that being, taking a mic and standing in front of an audience, whether that be a physical audience or a digital audience, and providing value. Of course, making sure that whatever the value that you provide is evidence-based and evidence-informed. I think that's really critical. We are trying to move to the forefront, but we also want to limit any misinformation, any challenges with incorrect advice. So I think there's definitely opportunity. But yeah, my advice is certainly start small. Start with immediate benefits, build your confidence in terms of technologies from there. Secondly, I would say, there's so much value in partnering with people and collaborating with experts, and then and drawing from experts in the field in terms of evidence, in terms of tried and tested tools, especially when it comes to clinical decision support tools. Those are definitely things that can be leveraged as long as you use the right ones. And then my last thing, I guess, just in terms of a piece of advice, would be, don't be afraid to try it. I truly believe that the future is not doctors versus AI tools or data tools. It's doctors supported by AI tools. And those are the clinicians that will provide the best care possible to their patients.
No, we're definitely looking forward to your talk without a doubt. But again, Dr. Ismail, thank you so much for joining us tonight here on INX Prime Live.
Thanks so much, Arif, and all the best.
Perfect. Thank you, guys. That is Dr. Muzzamil Ismail, who is actually a public health medicine specialist, just sharing with us the importance of this convention that's coming up and why AI plays such an important role when it comes to developing the healthcare sector. Now, on that note, we are going to take a quick ad break, but we'll come right back.